Today we were talking about workplace safety, especially in a healthcare setting. For me, the takeaway was we need to have the ability to make sure that our healthcare workers, nurses, social workers, people that working on the floor, interacting with patients every day, have the ability to have their first name on a badge. House Bill 39 does that. It allows that individual to have a little bit of anonymity in order to protect their privacy as well outside of the hospital.
Hosting this roundtable is really important. Our greatest asset at Mainline Health is our people, and protecting our people is something we really care about. And having the legislative representatives understand the risks that our staff face every day and the steps they can take to reduce those risks and protect our staff so that they're here when the community needs us is really, really important.
It's not a gender issue, it's for anyone in the healthcare professions, and that was alarming. That was really alarming. I am on the health committee. I am going to go back to my office and get on to House Bill 39.
As nurses, we build this character of putting on a nurse face that carries you through the day. We get bit on, we get bit, we get spit on, kicked, verbally abused almost on the daily. But this particular day, I just felt so unsafe in my own work environment, and that is why House Bill 39 is so important, because that patient who threatened to rape me did not need to know my last name.
Last names on an employee ID working in a healthcare facility. In today's world, it's a problem. There are ways in today's technological world for the administration to be able to identify the employee without them having their first and last name on their badge.
If you've never worked in a healthcare setting, it's hard to understand how frightening it is. And you walk into a room and you don't know, especially now with all the drug abuse and all of the situations that you come in contact with, it's even more frightening now than it used to be.
So often caregivers give to their patients, to their families, and they spend a lot of time giving, and they often don't spend enough time taking good care of themselves. So part of creating the environment where they take good care of themselves, it's creating safety. And it actually is the number one concern that I have, is the safety of our staff. So we want to make sure that we are caring for the caregivers.